Hey guys, welcome to another video. I just saw this article come out on the keto diet or keto-like diet may be associated with a higher risk of heart disease, according to new research. So I wanted to check out this article, and it's a media article, and it's not a specific scientific article that I could look at the study, which is unfortunate. But let's at least go through what the reports are of what came from the study, because I find it very interesting that keto diet may be associated with an increased risk of cardiovascular disease. I will say that just because someone is on a keto diet, that could be a good thing or that could be a bad thing. And it really comes down to what you're eating in that keto diet. The real question is that keto food that you're eating, that low carb diet, is it mostly processed or is it unprocessed food? And the more processed it is, the worse it's going to be, the more it's going to raise insulin levels and raise your degree of insulin resistance, as opposed to if it's unprocessed, then you're going to have lower insulin levels and lower insulin resistance. So which one it is, that really is going to determine things. Now, in general, a low carbohydrate diet will keep those insulin levels down. So you might be wondering, how is it that if I'm eating a very low carbohydrate diet, as the keto diet is, how is that going to create or lead to insulin resistance? And the answer is inflammation. When there's lots of low-grade chronic inflammation from highly processed foods, for example, even if it is a low-carb diet, that can actually lead the cells to, or the tissues to have this chronic low-grade inflammation, and that can actually lead to insulin resistance and leptin resistance. But let's go ahead and get to the article. So it says a low-carb, high-fat diet, keto-like diet, may be linked to higher levels of bad cholesterol and double the risk of cardiovascular events such as blocked arteries, heart attacks, and strokes, according to new research. Now, the bad cholesterol is what's called the LDL, but what most people don't know is that there's actually two types of LDL. There's type A LDL and there's type B LDL. The type A LDL is the large, buoyant LDL, and that actually makes up about 80% of our LDL. The other one, the 20%, is the small, dense LDL, or the type B LDL, and this is the truly bad LDL. So the one that's 80% of the LDL, the type A, that's actually not that bad for you. It's kind of cardiovascularly neutral, if you will. It's that small, dense LDL that makes up 20% of your LDL. That's the truly bad LDL. And that's the one at the molecular level that ends up being converted to triglycerides. And the small, dense LDL and the triglycerides, those are the true biomarkers of metabolic risk and cardiovascular risk. So when you look at those cholesterol panels, it's really not so much the LDL in general that you should be paying attention to, it's more so the triglycerides. Okay, so our study found that regular consumption of a self-reported diet low in carbohydrates and high in fat was associated with increased levels of LDL cholesterol, or the bad cholesterol, just talked about that, and a higher risk of heart disease. And this is according to the study author, Dr. Ayatan Latan, not sure how you say that. And this was done at St. Paul's Hospital and University of British Columbia in Vancouver, Canada. They said this in a news release. Of course, like I said, I don't have access to the actual study. They don't give a link here. Christopher Gardner. So this guy, Christopher Gardner, he is a PhD professor of medicine at the Stanford Prevention Research Center. I actually know who he is, and he's a very brilliant guy. He teaches nutrition courses at Stanford. He was not involved in the study, but he was able to look at the study. So he was saying that elevated LDL cholesterol should not be dismissed as simply a negligible side effect of a very low-calorie diet or a ketogenic diet. So in this study, researchers defined a low-carb, high-fat diet as 45% of total daily calories coming from fat and 25% coming from carbohydrates. So this study, which has not been peer-reviewed, was presented Sunday at the American College of Cardiology's annual scientific session together with the World Congress of Cardiology. It'd be nice if we could see that study, but it's not available. So they say that the researchers compared the diets of 305 people eating this low-carb, high-fat diet with about 1,200 people eating a standard diet, whatever that means. What is a standard diet? Using health information from the United Kingdom database UK Biobank, which followed these people for at least a decade. I like the picture here of these highly processed meats. So it looks like, so would be unprocessed pork here. Looks like bacon, some more highly processed meats. Then you have the dairy stuff that's processed, but how processed is it? Probably not that much compared to these processed meats. Okay, back to the article. I like how they give you all these interruptions to interrupt your train of thought. The researchers found that people on the low carbohydrate, high fat diet had higher levels of LDL and apolipoprotein B. And they go on to say that apolipoprotein B is a protein that coats LDL cholesterol proteins and can predict heart disease better than elevated levels of LDL cholesterol can. There's a lot of research suggesting or showing that the apolipoprotein B is a better predictor of LDL. And that's probably because there's, again, two types of LDL. There's the type A and the type B. If you looked at just the type B LDL, which labs don't check that. Routine lab tests aren't going to check the specific LDL types. They only check the total LDL. So when you go to get your cholesterol panel, it's not going to specify that, which should start to change, in my opinion, if you want to know a better biomarker to judge your cardiovascular risk. But for now, we don't have that. So after an average of 11.8 years of follow-up and after adjustment for other risk factors for heart disease, such as diabetes, high blood pressure, obesity, and smoking, people on a low carbohydrate, high fat diet had more than 2 times the higher risk of having several major cardiovascular events, such as blockages in the arteries that needed to be opened with stenting procedures, heart attacks, stroke, and peripheral arterial disease. That's what the researchers were saying. The researchers said in the release that their study can only show an association between the diet and an increased risk for major cardiac events, not a causal relationship. Yes, because it was an observational study, but their findings are worth further study, especially when approximately 1 in 5 Americans report being on a low-carb, keto-like, or full keto diet. I didn't realize that there's that many Americans on a keto diet. That's actually pretty surprising. Most of the participants, about 3/4 of which were women, he was saying that quite interesting to follow more dietary patterns, tend to be more interested in changing their lifestyles. So when asked if there were any groups that were not harmed by following a low-carb, high-fat diet, she said how long people are on the diet and whether or not they lose weight can counterbalance any LDL elevation. Now, there's a big misunderstanding when it comes to metabolic health and how it relates to obesity. For about 90 to 95% of people, it's the insulin that drives the weight gain and the obesity. So if the insulin levels are higher based on what you're eating, and if you're having more and more insulin resistance based on what you're eating, then that is what's going to cause the weight gain. And the weight loss is what happens when you go in the opposite direction. So it's based on if you're eating healthier foods and those insulin levels are coming down, and if those insulin resistance is coming down, then the weight's going to come down. So I said that's about 90 to 95% of people who are obese or overweight. But what about those 5 to 10% of people? They're actually what's called MHO, metabolically healthy obesity. So about 5 to 10% of people who are obese actually have normal insulin levels. They're not insulin hypersecretors. They don't have insulin resistance. Metabolically speaking, they're healthy, but they are obese. And that really comes down to genetics and epigenetics as to why they are the way they are with their weight. It has nothing to do with metabolic health, but that's only 5 to 10%. So about 90 to 95% of people who are obese, it's because of what's going on with the insulin. So what are the biomarkers of insulin resistance? Now we could talk about hemoglobin A1C and insulin levels and the HOMAR score, but the relatively indirect effects are the biomarkers that are indirectly affected, but definitely impacted by insulin resistance would be things like the LDL cholesterol, but more specifically, the triglycerides. So if you want to know if you're metabolically healthy or not, we could talk about looking at the hemoglobin A1C and the insulin levels and the HOMAR score, but also specifically paying attention to those triglyceride levels. 150 is a cutoff for elevated triglyceride levels. The higher you are, the more metabolically unhealthy you are. She said what matters to remember is that each patient responds differently, and so there's really an inter-individual variability between the response. It's absolutely true. What we found is that, on average, patients tend to increase their LDL cholesterol levels. She said what matters to remember is that each patient responds differently, and so there's really an inter-individual variability between the response. What we found is that, on average, patients tend to increase their LDL cholesterol levels. Dr. David Katz, a lifestyle medicine specialist who is not involved in the study, said that there are various ways to put together a low carbohydrate, high fat diet, and it's very unlikely they all have the same effects on serum lipids or cardiac events. And then he said that a low carbohydrate, high fat diet is associated with adverse effects in this study is a reality check for those adopting such diets just because they are in vogue. So again, it really comes down to, and I think a lot of people are missing this point, is that it really comes down to what are you eating, because not all carbohydrates are created equal and not all fats are created equal. There's the so-called healthy fats and then there's the so-called unhealthy fats. But even those monounsaturated fats, polyunsaturated fats, saturated fats, each one of those groups, they're not all created equal. For example, the saturated fat, there's actually saturated fat that's not so bad for you, and then there's saturated fat that's worse for you. For example, a lot of the saturated fat, long chain, even chain saturated fats that come from meat, for example, from pork, from beef, those are relatively worse compared to other types of saturated fat. For example, the ones that come from coconuts. There are shorter chain, even chain fatty acids, and they generate less inflammation. For example, one of those is palmitate, and it's a 16 carbon, even chain saturated fat. And when that's in the body, too much of that, it's going to generate more and more inflammation. So palmitate is something you actually need. It's in breast milk. Babies need it for that developing brain that contains a lot of fat, and that brain is growing so fast. So they need a lot of palmitate. But as you get older, you don't need as much palmitate. And the more palmitate that you're eating, the more inflammation that's going to be generated as a result. In fact, when you're eating sugar, fructose, too much fructose, that leads to inflammation in three different ways. One of which is when it's in the liver, that fructose gets converted to uric acid. And that uric acid ends up generating inflammation, not just in the body, but specifically in the brain. When it crosses the blood-brain barrier, it's going to generate this very chronic, low-grade inflammation there. And that's not good, because when you have inflammation, that leads to this insulin resistance and leptin resistance in the brain. So that means you're going to be less satisfied when you eat. Your cravings are going to be stronger, because that leptin is supposed to work in the hypothalamus and tell the hypothalamus, hey, you know what? You're full now. You can stop eating. But when there's inflammation there, that process doesn't work as well. So your brain's not receptive to that negative feedback from the leptin. So your brain's like, I want to eat more and more, even though you're already full. Most health experts say that trendy keto diet, which bans carbohydrates to make your body burn fat for fuel, cuts out healthy foods such as fruits, beans, and legumes, and whole grains. Yeah, so all of those foods by themselves, assuming they're not processed, refried beans are not the same as whole beans. Whole beans are super healthy. They got fiber in them, both insoluble and soluble fiber. They have protein, and they have the good kind of starch in them, where it's going to be a slower process to break it down. That's why you get slower and lower insulin spikes from that type of carbohydrate, that type of starch in beans. So they're saying in the keto diet, you limit your intake of carbohydrates to only 20 to 50 grams a day. The lower, the better. To put that into perspective, a medium banana or apple is around 27 carbohydrates, the full day's allowance. Those food groups that have to be eliminated to achieve ketosis are major sources of fiber in the diet, as well as many important nutrients, phytochemicals, and antioxidants. This is very true. This is of concern to many health professionals who consider the very low carbohydrate diet, aka the ketogenic diet, to be harmful for long-term health. Yeah, so one of the issues with a low-carb diet is that many people don't get enough fiber. The thing with fiber is you have soluble and you have insoluble fiber. They're both very important to do many different jobs in the body, one of which is to actually slow the breakdown of carbohydrates so that you get a lower insulin response as a result of that. But also, part of its job is to initially have a slower movement of food coming out of the stomach. Now, once it gets to the intestines, it actually helps move along the passage of food quicker. But the bottom line is it keeps you feeling fuller for a longer period of time, especially with that gastric distension, sending signals to the brain that are telling you that you're full. And actually, that's part of the reason why these new weight loss drugs are so effective. It's not the only reason, but part of the reason why they're so effective is because they actually slow gastric emptying, meaning they slow the contents being released from your stomach. And that's to help you keep you feeling fuller for longer, as not only those vagus nerves sensing that send signals to your brain, but also they release a hormone called ghrelin. And ghrelin travels to your brain too to tell your hypothalamus that you're full, you can stop eating now. Oh, one more point on fiber is that it actually helps to lower systemic inflammation in the body, including inflammation in your brain. And we just talked about why inflammation is bad. So here it says the keto diet has been around since the 1920s when a doctor stumbled on it as a way of controlling seizures in children with epilepsy who didn't respond to other treatment methods. Yeah, keto diet has been shown to help with that. And so has intermittent fasting, which really is also essentially another version of a ketogenic diet, because one is it's what you're eating that's generating the ketones. That's the ketogenic diet. But then with intermittent fasting, it's not what you're eating, it's when you're eating. And when you're not eating, you're generating ketones in that process. So both of these processes lead to the generation of ketones in the body. And in that process, what you're doing is, what's the common thread there? You're keeping your insulin levels low. So whether you're keeping your insulin levels low due to what you're eating or when you're eating, or sometimes both, getting those insulin levels down is what's really important here. And that's why you see all these incredible health benefits as a result of getting those insulin levels low and insulin resistance low. So whether it's keto diet or intermittent fasting or simply eating unprocessed foods, any one of those three things will keep those insulin levels low and improve your insulin sensitivity or decrease insulin resistance. So then it goes to say, while you can get all the fat from healthy unsaturated fats such as avocados, tofu, nuts, seeds, and olive oil, the diet also allows saturated fats like lard, butter, and coconut oil, as well as whole fat milk, cheese, and mayonnaise. So eating lots of foods high in saturated fat increases the body's production of LDL cholesterol, which can build up inside the arteries and restrict blood flow to the heart and brain. So again, I want to emphasize the point here that not all fats are created equal, and within that subdivision of saturated fats, not all saturated fats are created equal. The saturated fat you get from coconut isn't necessarily going to be the same saturated fat that you get by eating pork or beef. And just remember that it's the processing of food that's going to do the harm. So eating unprocessed meats is going to be much healthier than eating processed meats. So if you're telling me that you're eating a keto diet, but you're eating, let's say, lean chicken, seafood, all these things are unprocessed, or if you're eating a little bit of beef, a little bit of pork, it's unprocessed, eating things like seeds and nuts and avocados, that's going to be a healthy keto diet. But if you're telling me you're going to be eating pepperoni, sausages, hot dogs, that's highly processed meats, of course that's going to be harmful to your health. So yeah, one's going to raise the risk of having heart attacks and strokes, and the other is actually going to decrease the risk of heart attacks and strokes. So if you're going to focus on one thing, whether you're a keto lover or not, the key is to focus on eating the healthy types of keto food, which you can do, and just avoid the bad ones like the sausage and the pepperoni and so forth. So that's going to be all for this video. Thank you for watching. And if you want to learn more on how you can improve your health, definitely subscribe to this channel. And this video right here on saturated fat gets into all those details that I didn't cover in this video. So go ahead and check that out if you want.